Hello, everyone, and welcome to your global platform for thought, for leadership, for languages, and for strategic communication. Welcome to IFL-SC. Guten Tag. Willkommen bei IFL-SC Global Academy. Heute sprechen Sie über Epidemiologie. Dankeschön. Alors, bienvenue à IFL-SC. Aujourd'hui, nous allons vous parler de l'épidémiologie, cette science qui protège nos vies face aux catastrophes dans le monde. Merci beaucoup. Bienvenidos a IFL-SC Global Academy. Hoy hablaremos de epidemiología. Muchas gracias. Well, I am Marie. I speak many languages, and I'm happy to bring you today the fascinating journey into one of the most powerful tools of global health. It's called epidemiology. It's a big word, but I'm going to simplify things for you today because it is a science that shields us in times of disasters, in times of pandemics, and even in times of emergencies. So epidemiology, each time you hear epidemiology, know that it is a science that really provides protection when there are global pandemics. So before we move ahead, you know what to do. Please subscribe, like, share this video. Let's spread the knowledge, okay? Let's spread the knowledge on public health, on SDG. Let's raise leaders. Let's inspire millions of girls, women, people, boys across Africa and beyond. That's why I'm here. So go ahead. But before we continue, I'd like to tell you, as always, that my personal mission is a call to action through the GREAT agenda. G for gender equality, R for reality into action, A for education and empowerment, A for action on climate, and T for training for the future. So join us in my path. That's the path I walk, and I invite you to join me on that path. So I want to ask a question. Why does epidemiology matter to you? Is it really important? Because each time there is a disaster strikes, whether it is a flood, whether it's an earthquake, whether it's an epidemic, like we had a COVID-19, or even a war, okay? It's not just about buildings that are affected. Each time there's a war, there's an epidemic, it's not just about structures, it's not just about buildings being destroyed, but it's about lives being lost. And a lot of lives are usually affected during epidemics. And that's why, it's important to know what to do. And remember, wars, epidemics, disasters, they don't say, oh, the wicked people will die and the good people survive. No. Epidemics don't select only the bad ones. It affects everyone, both the good people and the bad people. Wars don't select the bad ones. It affects everybody. So how do we save lives if it happens now? Okay, there is a science which is called epidemiology. It's in public health. So where does that word come from? The word itself. Let's look at the word epidemiology. Well, it comes from Greek. It's combined. It's three syllables or three expressions combined. You have epi. Epi means upon. You have demos. Demos means people. Each time you hear demos, no, it's people. Then we have logos. Each time you hear logos, no, it means study. So epidemiology simply means that it is the study of what is upon the people. So anything that happens upon the people, that's the study of it. Epidemiology. So in plain terms, it's the study of diseases affecting populations with one mission: to stop them from killing us. Stop those diseases before they stop us. So you see, you have to be smart. You have to be fast, because epidemiology, if you don't stop the diseases, then the diseases will stop you. So how does it connect to the SDGs? We've always asked me, Marie, why do you talk so much about the SDGs? Yeah, and now you're moving into epidemiology. Well, it connects because it's not just a medical problem, it's also a global problem, and it connects directly to sustainable development. When you look at SDG 3, it has to do with good health and well-being, and fighting diseases, protecting mental and physical health. That's what SDG 3 does. Now, if you look at SDG 6, it has to do with clean water and sanitation. Now, think of cholera outbreaks. When there are cholera outbreaks, what is the first thing is to make sure the sanitation, to make sure the water people consume is very clean. Clean water. SDG 13 has to do with climate action. Now, climate is linked to disasters because during floods, during droughts, and during new diseases, epidemiology will help us track these threats. SDG 15 has to do with what? Partnerships for the good of the people. So, like during the COVID-19 pandemic, you realize that there was a global collaboration to save lives of millions of people. Even countries that were enemies had to come together to collaborate so that they only for one objective was to save lives of millions of people. So understanding epidemiology means that we're contributing to a healthier, a safer, fairer world. So do you understand now? So if you're being asked, what is epidemiology? Well, it's just like a detective work. Those of you who read a lot or watch movies, you remember famous Sherlock Holmes was a detective, a famous detective. So epidemiologists are kind of the Sherlocks of diseases, of disease control, because they have to collect clues, they have to follow trails, patterns, and then help the leaders to make informed decisions. So without them, the public would just be like blind in times of crisis. You would not know where the epidemic started. You don't know where the cholera outbreak, where it's occurred and how it's spreading. So you see that one of the very important functions of epidemiology is what we call surveillance, because surveillance, it keeps watch for diseases even before they spread. You go ahead and survey the land. Okay, where are the diseases likely to spread or to occur? They watch. And we even have field investigations, which means that they go into the communities and trace outbreaks. I remember when there was a Lassa fever and cholera outbreak, we find a lot of things that went into the communities. Say, okay, where are the centers? Where is this cholera outbreak from? That is what epidemiology does. You even have analytical studies, trying to understand why people fall ill. Because if you know why people fall ill, then you definitely know how to prevent it. So epidemiology go into analyzing all of that. What is the source of diseases? How did disease come about? How is the lifestyle of people? How does it affect their health? How do you prevent diseases from happening? And when they do that, they now come up with program evaluation. That means they check if the vaccines are enough, if there are enough vaccines for the people. They come up with intervention programs, vaccination campaigns, with all kinds of things. And they also help those who are in leadership with policy development, because they guide the government so that the government can make the right decisions as it affects the health of the people. So you see that it's very important to care, because diseases don't knock politely before they enter. They just barge into your house and then you find yourself in that. And when there are floods and earthquakes and wars, they do not discriminate. Diseases spread like wildfires. Hospitals are stretched. Some even get to breaking point. So epidemiology now brings order to the chaos, saving lives when everything else falls apart. So that is very, very important. So now, in terms of disasters, how does it help? Because when there is a disaster, everybody's, has panicked. So epidemiologists come handy because they do what we call early warnings. Before even an outbreak becomes a disaster, they have to issue out early warnings. Be careful, don't go out. For instance, during the COVID-19 outbreak, they talked about social distancing, where to maintain a certain distance from the next person. That's what you call warnings. Now, they even identify the risk. They'll tell you those who are not yet infected, they protect you from getting infected, protect the women, the children, those who are more vulnerable, the poor groups. So they come out to protect this very vulnerable group. Then they also look at disease control. I mean, organizing vaccines, medicines, and all kinds of campaigns to save the people so that most people are not infected. They even do what they call guiding resources. They send help where help is needed. Some of them even go as far as identifying funding, even reaching out to philanthropists so that they can gather those funds and gather even donations and spread them equally and equitably to areas where, they are needed. Now, we've talked a lot of theory now. Let's look at practical cases, examples now. Let me take you back to the sad COVID-19 pandemic. Remember how every government tracked daily numbers. In Nigeria, we had the Center for Disease Control, which was on live TV day and night. Epidemiologists were all over the place. Without epidemiology, vaccines would have been a chaos because they knew where the cases were concentrated and the vaccines were being, shifted to those places. It was a live reporting. That was all the work of epidemiology. Now, another example, very important, is that of the Ebola crisis in West Africa between 2014 and 2016. We saw how epidemiologists traced the transmission patterns, helping communities to break from that train. That was very important. Even in Haiti, there was an outbreak, cholera outbreak in 2010, which was very popular then. We saw epidemiologists spring into action because they pinpointed that contaminated water was a source. So they pinpointed those areas of contamination and they saved thousands of people from further contamination. So what should we do if we are leaders? Now I'm talking to leaders, I'm talking to managers, I'm talking to those who have the power to decide to save lives. Well, I would like to recommend that, first of all, you strengthen surveillance system, build better laboratories, improve reporting, so that in your state and in your country, those laboratories, epidemiologists can work in there and they have a very robust, strengthened surveillance system. Now, also support training of epidemiologists. There are not so many out there. For the few that are in existence, you train them more, and then even more experts are needed, especially in developing countries. Nigeria needs them more because we don't pray for epidemics to happen, but in case they happen, what happens? Do we begin to run helter-skelter again and then lose lives? So people have to be trained in times of peace. Now there's no major outbreak. So what are the government doing? I think the governments right now should be training epidemiologists in those areas so that in the eventuality of a disaster, we'll not have a lot of human lives being lost. Now, also, epidemiology can be integrated into disaster planning. Don't just build bridges, don't just build health roads in your state, build health systems too. That's very important. Let's have hospitals that are equipped. Let's have drugs that are available and affordable. Let's have trained manpower in those hospitals. Sometimes you go to the rural areas in some villages, you see a very fine, beautiful building, a health center. But by the time you get there, there is no doctor, there is no nurse, no equipment, no drugs. So it's not sufficient to have those big buildings there. But you need to equip them. You need to train people, the manpower that will work there. So you can see that epidemiology is not just a science, it's also a lifeline for the poor, for the vulnerable, for the women, for the children who don't sometimes, in such cases, don't even have where to run to. The forgotten of the society during disasters, they are running helter-skelter. So we here at IFL-SC, we don't just share knowledge, we also build a legacy. We are here to also build a leadership and impact. So you can join us. Your voice matters. Subscribe down there, click the button, share, even click the notification bell so that when a new episode comes up, you are there, you're informed, and you can share it. I would like to say, Auf Wiedersehen, salut, bonne journée, Odama, Abringang. I will see you in my next episode with more information and a lot of other things that we use to empower the society. Please remember, your voice matters. Join the global movement of empowering the people, because if you know and you don't give, then you're not useful to the society. Everybody has to join in the movement of teaching, of sharing knowledge, of impacting experience, of helping it. The movement of service with what you have at your own level. I'll see you next time. Thank you and bye for now.